Hi, I'm Dr. Doug McMahon, the Chief Medical Officer at the Allergy and Asthma Center of Minnesota. In this video, I'm going to talk about oral immunotherapy, otherwise known as food desensitization. If your child is going to go through this process, it's a good idea to have them watch the video as well. During the first visit, you'll be examined by a medical provider, and then you'll be given a very, very small amount of the allergenic food. It's so small, you won't even be able to see it, and probably won't even be able to taste it. And then you can do various activities for about 20 minutes. Color, read a book, watch a movie. Medical providers will always be there, but about 20 minutes later we'll do another exam, at which point we'll give a higher dose of the food. This is repeated for about 4 hours the first day. And then you'll go home. The next day, at home, you'll take your dose. This is repeated every day for about a week, at which point you'll come back to the clinic, we'll do an exam, and then we'll give you a higher dose of the allergenic food. And you're in the office for about an hour, again doing various activities, coloring, watching a movie, reading. This is repeated for about 8 months. At the end of the 8 months, you don't have to come to the clinic anymore for weekly updosing, as you'll be on a maintenance dose. But we will check in periodically to see how you're doing, and eventually down the road, depending on how you're tolerating the doses and your lab values, we may be able to space the doses to every other day or a few times a week. But it's important to know that you will most likely always be taking some sort of a dose, which often is in the form of the regular food at that point. All right, Brayden, you ready for your dose today? Okay, looks like you're ready. Great job, Brayden. Oral immunotherapy can be done as early as 6 months of age. We use a very precise, accurate dose with a syringe, a little bit of a flavored liquid with it so the kids enjoy it. Oh, you want more? Well, that's all you can get today. So the dosing is very regimented. You come in weekly to updose in the clinic. You're doing your home doses on a regular basis. That's it, I know you like it, but no more today. It's really important when you're doing oral immunotherapy to stay on an at-home schedule that's very regimented. So this morning we measured out Olivia's dose. Very accurate dosing on the scale. All right, Olivia, you can take your dose now.
This? The last one, Dada.
Okay. Great job, Olivia.
OIT?
One dosing option is to use peanut butter. Certain types of peanut butter will be recommended depending on your child's allergy or your allergy.
Me?
Not yours, your sister's. The dose will be discussed in the clinic on what dose to do, and then home dosing. Try to make sure that it's topped off. Very precise dosing. Then the dose can be added to something else that the child normally typically eats already. Okay. Here you go, Kenley.
Can you make one for me, Dada? Dad, can you make one for me?
Good job. After the dose, it's good to rinse it off with some water. This process has been used by hundreds of our patients and thousands of patients worldwide. It has let people live a more normal life by decreasing fear and decreasing the risk of severe reactions. If you have any further questions, we can answer them at your first OIT consult. I look forward to meeting you and helping you on your food allergy journey.